the timer, and here is your question. Right, so if you have read and understood, considering this surgical and outcomes teaching, kindly tell me if you can identify, beginning from the left-hand side first, if you can identify all the structures from A to F, please, quickly.
Yes, ma'am. B is internal carotid artery. A is middle cerebral artery.
Yes.
D and F is anterior cerebral artery. C may be choroidal artery, and E is anterior communicating artery.
So what is it, this image? What kind of image is this?
This is image of cerebral angiogram, sagittal section.
Good. Okay, if we can move on the right-hand side image, what is it showing?
Yes, ma'am. It is showing the various parts of internal carotid artery, and
Yes.
Also the middle and anterior and posterior communicating artery, anterior cerebral, middle cerebral and posterior communicating artery. It's basically internal carotid angiogram showing its parts and branches of the parts. C is of the lacerum.
Yes.
E is cavernous. B is clinoid. Then A is anterior cerebral. D is middle cerebral vessel.
Good. All right. Okay, we'll move on. Good. Okay, can you please tell me if you can identify the image? What is it showing?
Yes, ma'am. It is also showing the petrous part. So the internal carotid artery starting from the petrous part, which is B. It is giving a carotico-tympanic branch.
Okay.
Then there is a course, the whole course of the lacerum, the cavernous, and the clinoid and ophthalmic portions.
Yes. Can you please tell me which branch does it give before it gives anterior and the middle? ACA and NCA.
Yes, ma'am. It is ophthalmic artery.
Ophthalmic, very good. All right, good. What is this? Does it show anything or it's just the artifact? Okay, move on. Can you please identify structures from A to F in this image? What is it showing?
It is showing a cerebral angiogram, the coronal section. Yes, ma'am. And A is internal carotid artery. B is anterior communicating artery. C is anterior cerebral artery.
Yes.
D is middle cerebral artery. F is posterior communicating artery, and E is basilar artery.
Okay. Anything else that you could appreciate in the image? No? Okay, can you please tell me the course of the vertebral artery?
Yes, ma'am. Vertebral artery arises from the first part of subclavian artery. It ascends in the foramen transversorium in the cervical vertebra, C6 to C2. Then from there, it passes in the on the anterior part of posterior arch of atlas. From there, it enters into the skull through foramen magnum.
Yes.
Then it passes upwards and anteromedially to go in front of the brainstem. And at the lower border of the pons, two vertebral arteries unite to form one basilar artery,
Yes.
where also it gives the branches of posterior cerebral and superior cerebral and superior cerebellar artery.
Okay. So in that case, what is the territory of supply of basilar artery?
Yes, ma'am. It supplies the midbrain pons medulla,
Yes.
occipital lobes, and thalamus, and as well as both hemispheres of cerebellum.
Okay. Can you tell one branch of internal carotid artery which it gives before it enters into the skull?
There are no branches of internal carotid artery in the cervical part.
Good. Yes, one should be very clear about that. Okay, if we can, yes, here arrow is pointing at something. If you can identify that, please. What kind of image is this?
This is also, ma'am, cerebral angiogram.
Yes.
Showing a secular dilatation of middle cerebral artery,
Yes.
suggestive of aneurysm.
What type of aneurysm?
Most common is Berry's aneurysm.
Yes. What is the significance of knowing there is aneurysm?
It would tell us about the potential or future risk of subarachnoid
Very
hemorrhage.
good. If there is a risk, can you tell me if there is okay, if there is a risk or if there is infarct of middle cerebral artery, how would the patient present?
Yes, ma'am.
What are the signs?
Yes, patient would present with contralateral upper motor neuron type of palsy of the face.
Yes.
Scaling the upper part of the contralateral face. Then there would be hemiplegia of the opposite side,
Yes.
involving upper and lower limb. And also if the dominant lobe is involved, then there would be aphasia due to involvement of Broca's area.
Very good. At what level, if you can tell me, the common carotid artery bifurcates?
Common carotid bifurcates at C4 vertebral level.
Yes. Which vessel traverses the foramen transversum in cervical vertebrae?
The spinal, anterior and posterior spinal
Vertebral artery pass through the C1 vertebrae. Okay, can you tell me what is circle of Willis?
Yes, ma'am. It's the circle of Willis is formed from the branches of internal carotid and the basilar artery.
Yes.
The branches from internal carotid are anterior cerebral artery, and anterior communicating artery communicates with both of anterior cerebral artery. Then there are middle cerebral artery. There is posterior communicating artery, and then there is posterior cerebral artery.
Okay, it wasn't that much clear to me. Can you please tell me what are you looking at right now? If you can identify 1, 2, 3, and 4 structures, please.
Yes, ma'am.
Which one is it?
Yes. This is middle cerebral artery.
No, it's inferior. Okay, and this is middle. Which one is this? Main stem?
This is internal carotid
Very
artery.
good. And which one is this?
This is also middle cerebral artery.
Very good. Yes, yes. Right. Good. Thank you.
Thank you, ma'am.
I think I asked you almost all questions regarding this. Yes, Dr. Abbas, you raised hand. Yes, please.
Okay, ma'am. Thank you very much, ma'am. There was a question you asked her, but that she was describing the branches of the posterior circulation.
Yes.
I'm sorry, anterior circulation, but it's actually the posterior circulation.
Posterior. Yeah.
Yes, there was one that showed the image will even make it easy for you. It looks like as if there's an occiput, and then there's
Which
an
one?
artery. I think it's the third image.
Yes. Sorry.
Yeah, you just passed it, ma'am. Yes, this one. So
Yeah.
this one, B is the vertebral artery actually,
Yeah.
and then A is the basilar artery. C, I think they are the muscular branches of the vertebral artery, and then E is the anterior inferior cerebellar artery, and then D is the superior cerebellar artery. Basically, that's my contribution. Thank you, ma'am.
Thank you.
Thank you.
Right. Yes.